Hello. This week's topic is domestic and economic policy, so please read Chapter 13 before you begin the written assignment for the week. I want to talk about a couple topics that are discussed in Chapter 13. One is the issue of healthcare, and the other is immigration. In the book, they discuss the healthcare system in the United States. As you probably are aware, there's been a lot of discussion in recent weeks and months about the Affordable Care Act, or the ACA, which is also sometimes called Obamacare. This was the law passed in 2010 when President Obama was in his first term. Democrats had control of both the House and the Senate, and they passed the Affordable Care Act as an effort to expand healthcare access in the United States. The ACA is not primarily a government system. It relies mostly on the private sector to provide health insurance, but there is a requirement in the law that says that everyone must have health insurance. This is called the individual mandate. It's been a subject of some discussion and controversy because there are a lot of people who argue that the government should not require people to purchase a product. But on the other hand, there's the argument that if someone is uninsured and they go to an emergency room for care, they cannot be refused care there, and we all end up paying for that in the end. So the Affordable Care Act basically was an effort to expand health insurance to the approximately 20 some million people in the United States who did not have health care when the law was passed. The majority of Americans have had health insurance either through an employer or through one of the government programs like Medicare, which is health insurance for senior citizens, or Medicaid, which is health insurance for low-income families as well as for many seniors as well. But to purchase, for an individual to purchase health insurance on their own before the Affordable Care Act was very hard for them to do because of the expense. Trying to purchase health insurance from an insurer if you were on your own as opposed to being part of an employer was very prohibitive and very difficult for most people. The idea of the Affordable Care Act was to create health insurance exchanges in every state where multiple insurers could sell policies, and it would be a more affordable situation since you'd have many people purchasing in these pools, these insurance pools. And then if someone could not afford the policies being sold on the exchanges, they would receive a subsidy from the federal government. The ACA also expanded the Medicaid program so that more people could qualify for that insurance program for low-income families. So there were a number of things put in place to make it easier for people to purchase health insurance and have it so that they could comply with the individual mandate. If someone does not have health insurance under the law, then they do pay a tax penalty each year when they file their income taxes, and so that is in place. The reason for the individual mandate is that if the healthcare law also prohibits insurers from denying coverage to people with pre-existing conditions, and the idea is that if there was no individual mandate, then people who were healthy might just wait to get insurance until they got sick. But the problem with that is then when you're insuring only sicker people, it makes it expensive for everyone. So any insurance program needs a mixture of healthy and less healthy people in order to be affordable. So the individual mandate was necessary in order to ensure that there would be a mix of both healthy and maybe not as healthy people in the insurance pools. So that was the reason. There has been discussion in Congress about whether to get rid of the individual mandate, and that may yet happen in the coming months. And we will see what happens to the ACA if the individual mandate is eliminated. The other part of the chapter I wanted to talk about was the immigration discussion. The authors do discuss the immigration system in this country, people coming from other countries to live in the United States. It should be noted in this discussion there is a distinction, of course, between immigrants who are documented or legal versus those who are undocumented or what some people would say illegal. A documented immigrant is someone who has the proper paperwork to be here. They may or may not be a citizen of the United States. but that they have perhaps a green card that allows them to live and work in the United States legally. Someone who has becomes a citizen is at that point a citizen and doesn't need any documentation to verify that they can remain in the country. So when someone passes the citizenship test, they are equal to every other citizen in the country, whether that person was born here or came here from another country. Then you have people who are undocumented immigrants. Those are people who are not here legally anymore. In some cases, in many cases, in fact, they came here legally originally, but overstayed their papers and have not been able to restore their legal status. That has been the focus of some of the immigration reforms that previous presidents had proposed prior to President Trump. The idea of making it, creating a pathway for those who are here illegally to become legal so that it would benefit all of us. The current president is resisting that idea of a path to citizenship. His focus has been more on deporting people who are here illegally back to the countries that they came from. When President Obama was in office, he attempted to enact immigration reform, and so did President George W. Bush, his Republican predecessor, but their efforts were stalled in Congress. It is a very touchy debate that takes place on immigration reform, and so far presidents have not been able to get Congress to act on it. When President Obama was in office, he did initiate an executive order that resulted in what's called the DACA program, Deferred Action for Childhood Arrivals. And it basically allows children of immigrants who came to the country at a young age who are not here legally, so we're talking about the children are not here legally as well as their parents. If they've lived here for most of their lives and they're of a certain age and they're otherwise obeying the laws of the land, the children are allowed to stay in the country legally and are not going to be deported, even though they are not technically legal residents of the United States. So this DACA program has allowed them to go to school, to go to college, to work, and to do things that other legally documented people are able to do. It hasn't changed the status of their parents, nor has it meant that they became citizens, but it was a way to try to prevent more deportations from occurring. Back in September of 2017, President Trump announced that he was reversing this order. It had been implemented through an executive order by President Obama, so President Trump only has to just reverse the order. He doesn't have to go through Congress in order to reverse it. And so that is what he's announced, is that he's ending that program as of March of 2018. So Congress could, at some point between the time of President Trump's order and March of 2018, Congress could try to pass legislation to continue the program. It is a very popular program, actually, but President Trump has argued that President Obama initiated it illegally. Constitutional scholars have different opinions about that, but generally there's a feeling that President Obama in that case was okay within the Constitution when he did that, so it was not violating it, but there is an argument that he was. So in any event, President Trump's emphasis, as you know, has been on deporting immigrants who are here illegally. The problem, of course, is that there are about 11 million or more undocumented immigrants, and it would not be feasible to deport all of them, or even a large fraction of them. And so, again, most observers say that we would need to do something in our system to make it easier for people to become citizens so that they are not here illegally, but also making sure our borders are secure so that people are not sneaking over the border into the United States illegally. But again, it's a debate because a lot of these people are fleeing very bad conditions in their home countries, and while we certainly have a lot of people in this country, we can also absorb a lot. And it should be noted too that the vast majority of undocumented and documented immigrants are employed in this country. They are working. They're paying taxes. They're paying income taxes. They're paying sales taxes. If they own a home, they're paying property taxes. So these are not people who are draining our system. They're actually contributing to our country. Now, not all of them, of course. There are some who break laws, but most of them are paying taxes. But because they're not here legally, they don't qualify for most, if any, federal programs, so they don't get welfare, contrary to what some would argue happens. They do not get welfare benefits of any kind, or unemployment benefits, or other programs that would benefit American citizens or legal residents. So it is important to kind of pay attention to the facts in this discussion. Sometimes they can get muddled in the political debates. Please make sure in the question for this week online, I included a website that gives more information on the facts about the immigration issue. So please make sure you go to that and take a look at some of those facts about the immigration system in our country. So this is kind of a long video, but I wanted to address two of the topics from chapter 13. Please read the chapter, complete the written assignment for the week, and contact me with any questions. Have a great week. Thank you.